So the hyoid, being a midline structure, generally speaking, coming across the midline with one hand has more opportunity to be sensitive. More people can feel more negative things about it. It doesn't mean that they will, especially if you do it reasonably well. Generally speaking, if you're going to work on the hyoid, the best place to do it is in supine. You can do it in other positions as you experimented with and did a good job. Usually, I just call this the pinball, right? So you come down the neck and you kind of come to the middle. So you'll feel like a ridge on the SCM, and that means you're relatively close to it. Are you going to find the hyoid perfectly? Probably not. Probably not. But you're just going to slide one side and slide the other side. So moves somewhat that way, moves a lot that way. You agree? Mm-hmm. Yeah. So I can slide it to the left. I can't particularly well slide it to the right. If I was going to do this across midline, sitting is okay. Standing is probably better because you see what's going to happen to my hand. My hand, her torso, probably a bad move. So essentially what you would then do is, because now you can see it, so with respect to patient positioning and the concepts that I utilize, anatomy exposed, free to move in the planar planes required, and preferably visible, right? This is actually technically better on that level. I would come in here and I would stay tented. I don't want to drop. I want to stay tented. So it's going to still be one side and the other side. I would stabilize the head and I would slide this way, slide this way. Again, will slide, doesn't slide so good, right? And you can see how, regardless of what position I would put them in, it would be the same, right? So we want to be somewhat cautious with that. You have to have good reason to do it, but to actually do it, the head will stay relatively stable. If you're at the head of the table and doing what I call the pinball, I call it that, but I always forget pinball. I want to say ping pong. But I'm wrong about the thing that I want to say. This is nice and gentle. The head is stabilized because your arms come down. So the head is stabilized because I'm around it, right? So as long as I'm not doing this, then the head is stabilized and the hyoid will move. It is subtle, but there you go. You agree that this feels nice and stable. This probably feels the most relaxing, right? Especially compared to the other stuff that people tried and you tried. This feels nice. It doesn't feel unsafe. When I do it this way, it still feels okay, but this is better. Fair? Okay. So that's probably the best position. But yes, you can do it other ways. If the patient is in supine and you want to use one hand, stand up so that you're not resting your forearm in weird places. If you happen to be in lateral, figure it out, but maybe just don't try. Fair enough? Sweet. And you can press that button again.